Opening this spring, a newly expanded emergency department nearly complete now at Carilion Roanoke Memorial Hospital. This is all a part of the Crystal Spring Tower construction, which will serve thousands of patients every year. 10 News anchor Rachel Lucas is there. She joins us live tonight to talk about what it means for you. Rachel, they started this project way back before the pandemic.
That's right, and despite the pandemic, they were able to stay on schedule with the Crystal Spring expansion project, which represents a $500 million investment. Now, Roanoke Memorial Hospital is the region's only level 1 trauma center, which is why it was so important to be able to expand into this new facility so they can continue to meet the growing need of patients here in our area. Now, I got a sneak peek tour of this facility ahead of its opening.
Years in the making, the new emergency department at Carilion Roanoke Memorial Hospital's Crystal Spring Tower is ready to open.
Been working on this since 2019, so it's been a long time coming, and we're excited to be at the finish line.
Very excited. On a scale from 1 to 10, a 10.
Rin Brindell, Carilion VP of Emergency Medicine, says the much-needed expansion was designed in part by doctors and nurses who will work here every day.
So we're really hoping to increase efficiencies from the nursing and clinical staff standpoint.
Which is crucial because this hospital is the region's only level 1 trauma center, meaning they see the most complex and severe trauma cases.
We have patients being transferred to us and or traveling from via EMS from West Virginia, from southwestern Virginia, from Tennessee, and even some portions of North Carolina. So our radius of patients captured area is very, very large.
That's why Dan Freeman, Senior Director of Trauma Programs, says a new helipad was added to get patients treated quicker.
So we have 2 helipads now, not just one. We have one on this tower that will serve as our quote-unquote trauma elevator. So any patients coming into the emergency department for trauma and or cardiac or stroke patients that need to come through the ED will come through that new helipad.
The expansion allows for more patients to receive care, now with 125 beds and an additional observation unit.
So we have expanded our care areas significantly. So our hope is that we put people in more fixed rooms and provide the care in actual rooms, reduce some crowding, reduce delays, and increase the quality of care.
There are now 5 trauma bays, including the region's first reserved for children. We got a tour of the facility.
So this is an area that we call our fast track or results waiting area. It is quicker care, maybe some urgent care type visits that would not require a traditional room with a cardiac monitor or oxygen. These patients previous to the construction may have gotten care in the triage space, which did not offer the privacy or the luxuries of the child-friendly environment that this room does.
A big part of the design focuses on making children more comfortable. There's a dedicated pediatric emergency waiting area, triage space, and patient rooms.
And you know, as a parent, I think it just would ease the nerves of anyone who was coming to the emergency department on a day that they certainly didn't plan to.
Now, I do want to let you know there is a new parking garage that's being built adjacent to this facility, which will allow family members with patients here in the emergency room quicker access to the facility. And when this does open, there will also be a new entrance that you'll need to know about. That is right next to the old entrance, but it will be clearly marked so there will be no issues on opening day. Now, this new facility, as well as the additional parking garage, will be open soon this spring. I have much more on our website at WSLS.com. Live in Roanoke, I'm Rachel Lucas, 10 News, working for you.